TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Welcome,
Thank
Dr.
you.
Philaya. I am so excited to be having this conversation with you today. It's so important. And I'm just going to recall how we met. We met 1 year ago during a team building exercise. We were paired together. We didn't know each other. And that's always awkward, don't you think? It's like, okay, we're doing this team
Mhm,
building. And
mhm.
then you say, my name is Luther Philaya. And I'm like, how am I going to remember that? Because I bad with names, and you're like fillet of
Yeah,
fish.
yeah, absolutely, absolutely.
So that
Yeah.
put me at ease right away. I was
Mhm.
like, okay, fillet of fish. I can remember that.
Well, this is not Amber, shoot, this is Autumn. No, but that's what I thought. I
Yeah,
said,
yeah.
oh no, this is Autumn. And I know she does video stuff, but I don't remember what it was all about. I was like, yeah,
What is going on?
yeah, but I know she does video stuff. And so anyway, here I am.
Here we are, and we're
Yes.
actually here to talk about a very important, very serious topic, but we can start off with a little humor. But
Humor's good.
it is. So what I'd like to talk about today and what you've been so gracious to share is a topic that is rarely spoken about and is so important, and that is about our mental health of our physicians
Mhm.
and some of the culture surrounding being a physician, being in this position of power, being in this place where mistakes are not okay,
Mhm.
and
Mhm.
then how that can lead to suffering that can then lead to addiction. So this is a big topic.
Mhm.
And so
Mhm.
we're here at the TNT conference and you lead a recovery group
I do.
for
I do.
medical professionals.
Right.
Why is this work important to you and how did you get into it?
Well, as they say, lived experience. What I call it is addiction and recovery, and it really was two different phases of my life. And when you talk about perfectionism, I was thinking this morning before we talked. I said, what was it that led to my addiction? And I thought it was untreated mental illness. I was too afraid to get help, perfectionism, and self-loathing.
Mm,
And what I learned was that drugs really help that.
mm,
Benzodiazepines, Klonopin was my favorite. And that was that relaxed, just I feel super relaxed. Then adding opioids to that, oxycodone, which by the way, way back then you could get, before the whole opioid thing came, you could just get a colleague to write you a prescription. Opioids energized me.
mm.
And then if I wanted to just smooth it all out, then a nice gin and tonic worked real well too.
Wow.
So it worked really well till it didn't.
Mm-hmm.
And as I know they just talked about this morning, which is interesting, is that you reach a point where they're not having their effect anymore, and you're just taking them to not have the side effects of withdrawal.
Oh, brutal.
So I reached that point where they were no longer working, and the self-loathing I talked to you about, the perfectionism, realizing I wasn't perfect, the um, uh, the anxiety associated with all of it, the depression, being in a deep dark hole. And it's really a short way of telling a very long story, but I ended up this close from taking my life.
Oh my gosh.
Yeah. I was that despondent. And thankfully, a friend intervened, or I would have overdosed and died. But that's in a nutshell pre-treatment. And then on October 10th, 2012, really began the second half of my life when I went into treatment. Uh,
But let's back up just a
yep.
bit. You are a family
I'm a
physician.
family physician, right,
Yeah,
and addiction medicine now, but it was rural family medicine for 20 some years that I did, as
in
well as work in the
Minnesota.
emergency room in Minnesota.
Yeah, so you were doing this extremely important job while simultaneously self-medicating and going through a lot of troubles
Hmm.
yourself and then
Hmm.
trying to show up for your patients.
Hmm. Yeah, and it was difficult. A big part of it was, trying to keep this perfectionism. And I use the illustration. I was well liked. I really was well liked in my
I believe
practice.
that.
But I could have 100 patients and 99 of them thought I was doing a great job. One didn't like me. Guess what I would focus on?
Mm,
The one. I would go home and obsess truly. Why don't they? Like, what is it about it? What am I doing wrong? Realizing that statistically, I was actually doing pretty well with 99 of 100 patients. So,
That's our negativity bias.
right,
And then if
right.
you've got like an underlying self-loathing, as you said, then that's going to
Hmm.
bring that out
Hmm.
because we're paying more attention to that
Right.
because it correlates with our own internal story. So can we talk about a little, can we dig a little bit deeper
Hmm.
about the culture of being a physician and how that contributes to um, the suffering that you experienced?
Well, that starts back in medical school. It actually starts before medical school because everything is so competitive. And, to get into med school is competitive. And then when you get into medical school, it's about getting the high grades. It's about getting the good board scores. And so it's always competition, 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 which to me breeds perfectionism.
Hmm.
And then on top of that, you have a system, at least back in the day when I went to medical school, you have a system that's very, very, what's the word I'm trying to use, where they look down on you. Uh,
Like a hierarchical
well, it
or
is, but it's almost that the teaching isn't teaching in a gentle manner. It's lecturing and saying, I want you to regurgitate what I just said,
mm-hmm,
you know?
mm-hmm,
And if you don't regurgitate it just like I said it, shame on you.
mm-hmm.
You're not going to be a good doctor. And I
Oh
mean
boy.
that's not that unreal. So intimidation, that's the word I was trying to think. Yeah.
Yeah.
Lots of intimidation.
Wow.
And so having that, it really, it made me, and not just me, other physicians in training too, begin to question, am I any good at this? Am I going to be a good doctor? It doesn't seem to me to be about me as a person. It's how much I know. And it not only if I know it, but make sure that I can regurgitate it correctly on
Mm-hmm.
a test.
Mm-hmm.
Um, so there's a lot of that starts early on. I think the thing too is that societal pressure is so high. We
We want our
are
doctors to be perfect and give us the perfect treatment.
right, right. And we start to believe we have to be perfect. So our humanity, which is something that I really stress with my groups now, our humanity gets lost,
Hmm.
completely gets lost. We are no longer um, people. We're doctors. And part of going back to my own addiction, what led to it was I just took that white coat and wrapped it around me like this.
Mm-hmm.
Now I was secure and I was covering all the insecurities up.
Wow.
And so really my definition was, I'm Luther Philaya, I'm a doctor,
Hmm.
which was even more important to me, believe it or not, than being a husband and a father and all the other things. I would
Wow.
never have said it back then,
Mm-hmm.
but my identity was in being a doctor.
Mm-hmm. Wow. So then when the addiction got to a breaking point,
Hmm.
which thank you for sharing, that's so difficult, then you like had to fall
Hmm.
before you could come back. I mean, that's if that's your whole identity, like that must
Right.
have been very difficult.
And yes, to your question, but the interesting is the bottom didn't hit till I got out of treatment.
What? Oh no. Okay.
So I went into treatment, and just to make a long story short, the withdrawal, especially withdrawal from benzodiazepines, is a long, 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 drawn out ordeal. I was in treatment for 103 days. I don't remember the first 6 weeks. I was sick, and generally, when they say that it takes 1 to 2 years to get better
Hmm.
and completely recover from benzodiazepine addiction, it did,
Wow.
to really feel back to normal. But in that time, the thing that I learned, and one thing that always sticks out at me, is the counselor said, Luther, look in that mirror right now and say, Luther, I love you.
Oh my gosh.
And I said, there is no way, and you know what, that I'm doing that. There is no way. I don't, that creature I hate.
Oh
And
my
now you've
god.
taken my white coat away from me.
Oh my god.
What am I supposed to do? And so he said, until you learn the art of self love, until you learn that it's okay to love yourself, you're never going to get better.
And that's really hard to do when someone's at rock bottom.
Hmm.
So
right?
how did you do it? Did you do it?
Lots of counsel.
Did you do it?
Well,
You love yourself now? Can you do
oh,
that?
now absolutely. Luther, I
Right.
love you. No, no, it's second nature now.
Okay.
And realizing that it's really the core of who I am. If I don't love myself, I can't love anybody.
Mhm.
I can't be a good doctor. I have to have that self-confidence, that self-love, and realizing that when all the things are stripped away, I'm still okay. You know, as Brene Brown says, perfectly imperfect.
Mhm.
I love that term, you know. One thing I made in treatment was a little plate and it said, I am enough.
Mm.
And I still have that. I turn it around once in a while. I go, oh, yeah, that's right. You said I am enough. I'm enough. And I am.
Yeah.
And I even stressed it this morning in our group. I said, yeah, it's okay for all of us to be perfectly imperfect.
Mhm.
And we're enough where we are. And when you see tears flow in groups, it's, I guess it is having an effect, but it isn't just me. It also makes me sad that we have all these people and they're hurting,
Yeah.
and some are getting help, and many are afraid to get help.
Mhm.
So when I got out of treatment, and I think that this happens with a lot of people, I really forgot that there was a lot of destruction around me that I had created. And so I
Oh.
got out. Okay, people are going to call, my colleagues are going to call me back. I'm all better now. I'm going to go back to work.
Yeah.
Well, the phone didn't ring.
Huh.
You know, people didn't bring casseroles over to say, "Hey, I'm glad you're here." And in fact, one of
Interesting.
the terms or quotes that I hear or say often is, "There are no casseroles." People don't bring casseroles over when you're in recovery.
Hmm.
If you have if I had a colleague that was in an accident or was sick, what would you do? You'd be running over. Here's a casserole, feeding their family.
Yeah,
There are
yeah.
no casseroles in addiction and recovery.
I never thought of
Yeah,
that, but
yeah.
yeah, you're right.
Mhm.
And that's one of the hardest things you're gonna go through.
Right. So getting out of treatment, I was like, oh, my colleagues are going to call. They're going to say congratulations. You know how many calls I got? Zero.
Oh my gosh.
They disappeared, completely disappeared out of my life.
Whoa.
The company that I'd worked with for 22 years fired me.
Whoa.
Yeah. I became from, I turned from, or how do I say this? So I became a pariah where I once was really loved and liked.
Mm.
So, um, so you talk about rock bottom. We are now going down to the rock
Wow.
bottom.
Yeah.
So because I diverted my prescription drugs, meaning I wrote prescriptions illegally, which the DEA doesn't like.
No.
I found out later how much they don't like it. But anyway, because of that, I was reported to the medical board. And so I got out of treatment in January of 2013. In October of 2013, I went in front of the medical board, um, and my license was suspended. Going in front of the medical board is like going in front of a congressional subcommittee. I'm here, there's a table like this. They're sitting looking at you like this.
Mm.
Yeah. So it was very, very uh, difficult to go through. And then leaving that room, and I thought, oh, great. I worked so hard for this, and now it's suspended. I don't have it.
Gone.
One of the requirements with the American Board of Family Medicine to be a board certified physician is to have a valid medical license. So I didn't have a valid medical license. Therefore, I lost my board certification. In the summer of 2014, I got this thick, long letter from the Drug Enforcement Agency. And I remembered the day I opened it from the mailbox and said, you're being charged with 90 some felony accounts, one for each illicit prescription that you wrote.
Oh
And
my gosh.
um, that was almost rock bottom.
Wow.
So I have no license, I have no board certification, and now I'm facing charges from the DEA. You know, and I want to say that I'm not looking to say I didn't deserve this. I mean, this is the consequences of addiction. And I'm not, you know, and so I really want to, it explains, Addiction explains why I did what I did, but doesn't excuse it.
Mhm.
Those behaviors are still behaviors, whether you're high or not, you know. And so, the long story short, with the whole DEA thing is that I pled it down to one, and fortunately, the judge gave me a sentence of 2 years of probation and community service.
Okay.
I could have gone to jail. I could have gone to prison easily, but fortunately, I didn't. So I had the probation, which actually was really kind of a neat thing in a way because he was an African American. I think he must have been an ex-linebacker or lineman. He was this big, imposing judge, and he pointed at me. He goes, "You are going to do your community service in underserved treatment centers in Minneapolis, St. Paul."
Wow. Smart
And I said,
judge.
"I don't know anything about that. I practiced in rural Minnesota." It was the most uh, incredible experience that I had, and it really, really opened my eyes to the plight of the underserved.
Mhm.
And it really was transformational. And if I could write a thank you letter to that judge, I would say thank you for what you did.
Yeah.
And so I would say that at that point, it was my almost rock bottom because there's a little more to the
Oh my
story.
goodness, more. You've been through so much.
So Minnesota fortunately has a health service professional program. So I did monitoring through them. I had to do 3 years of monitoring. Once the monitoring was done, the board had told me, we'll give you your license back. And to their credit, they gave me my license back, after which the American Board of Family Medicine said, okay, you can have your board certification back. And once I paid my dues to the DEA, I didn't tell you about the big fine I got, and I'm not going to go there. It was significant. It was from the DEA that I had to pay. But anyway, once I got through that, they actually gave me my DEA certificate back.
Okay.
So this was 2016. And so at that point, I'd been working in clinical informatics away from medicine, which actually was a really good thing. There was a lot of self-discovery time in there. In 2017, my daughter, who had also been struggling with addiction and mental illness, she came to live with my wife and I because she was really, really going downhill. And the one thing I learned really quick on in this situation was it is far easier to be the addict than the parent of an
Oh,
addict.
wow.
Because I watched her cycle downhill even after treatment. And in August of 2017, she killed herself.
Oh my gosh, I'm so sorry.
That was my rock
Oh
bottom.
my gosh.
And I've earned the right to get emotional about that.
Absolutely.
That was when I came this close to reverting back to using drugs and alcohol.
Yeah.
But what happened was my recovery network came around me. I said, I can't do this recovery thing anymore. And they said, you grieve and we'll work your recovery for you.
My gosh, it's beautiful. Yeah.
You grieve,
Yeah.
we'll surround you. That was powerful. And that really taught me the power of recovery, of the community.
Yeah.
We will love you where you are at. You're grieving, you're going through, no parent should bury their child. You're going through this hell right now. We got you.
Yeah.
So that was my rock bottom. And at that point, I had two ways to go. One was to say, I'm going back to drugs and alcohol. I'm done with this. I can't do this anymore. I just lost my 25-year-old daughter. Or I can take Lindsay, her name, and I can say, Lindsay, I'm going to, one of the legacies I want to leave is that I'm going to go back into this and fight. So I was hired by Hazelden Betty Ford in Center City and accumulated enough hours to sit for the boards. And so then I became board certified in addiction medicine and became an addictionologist.
Oh,
I guess that's the term they
I
use.
didn't know
Not
that
addiction.
term.
I was thought, is that like a cardiologist? It's an
I've not
addictionologist.
heard of that. That's cool.
Um, and it has been the best years of my life.
Wow.
I shed the white coat and I keep it off. I'm kind of a,
Whoa.
this is really dressy for me. I'm a blue
Yeah.
jeans and flannel shirt sort of guy when I go to work.
Yeah.
I shed that. It's gone. And I look at my patients. These are suffering human beings. They're not the patient in 34 who's got the gallbladder problem.
Mm-hmm.
And being able to look at that human suffering they have and say, been there, done that. You know, let's work on what we can do to help you start on the road to recovery.
Yeah.
So, and then, yeah, thanks to Steve DeLisi, who we know well, I got involved in the TNT program.
Yeah.
And one of the things I've always wanted to do is that when I get to this point in my career, I want to pass that baton on.
Yeah.
And I'm so thankful to be doing it. And this is such a great way to do it. So
Absolutely.
that's kind of a nutshell of the journey.
Yeah. That's wow. What a journey. And thank you for sharing. I think many people would be afraid to share the struggles given, what physicians stand for and how much perfection is expected. But as you mentioned in the beginning, that's, it's dehumanizing,
Hmm. Hmm.
And so what is the main message, the core nuggets that you like to share as a mentor for addiction medicine students and as a leader of these recovery groups for those in the medical field?
When I first start with my mentorship groups right off the bat, even when we met for dinner at our first conference in March, and certainly at our first meeting that we have in April, is to stress their humanity.
Yeah.
Ask them, you know, tell me about your family of origin. Tell me what makes you tick. And then why did you choose this crazy career of medicine? And then why did you choose the fellowship? But each time that we meet and we talk, the very first thing is, how are you doing?
Yeah.
How are you doing? It's someone, the real life examples is someone said, I just lost my father 2 weeks ago.
Mm-hmm.
And I said, wow. And they said, I'm not going to be sharing much today. Another person said, I was in an accident and my face is all bruised. I don't want to be on camera. But realizing that each person every month comes into the mentoring session with a different slate than they had the month before.
Yeah.
So instilling on them, even before we share all this great knowledge we're learning in TNT and we present cases and do all that, stress to them over and over and over that you're human beings. Then you practice medicine. Now let's get together and we can share these things, you know, having that commonality among us.
Mm-hmm.
So that's one thing. I think another one that really burdens me a lot, and I don't have an answer to it, is the health professionals that are struggling. When I tell my story, it doesn't make health professionals want to go get help.
It does not?
No, because think of what happened,
Yeah,
the vindictive
yeah.
nature. And I live in a good state. I live in a state where they really do offer help, but there are many states that don't.
Yeah, so tell me about that path back to
So,
medicine.
so Minnesota has a health profession service program, HPSP, and that is a monitoring program where you have to get psychiatric and psychological counseling, plus random urine screens for 3 years. And they truly are random urine screens. And part of that monitoring program then is communicated to the place of employment. All right. Now, not all places of employment, such as where I worked before, are real receptive to that. Um, and then after a 3-year time period, you complete the program.
Mhm.
So, and it worked well for me. What really worked well is it's when I started the program, it was really I needed it
Yeah.
because I never knew when I was going to have to get a urine sample. Never knew, and these urine samples are very, very, very specific, urine samples. So it was always that accountability thing. As I neared the end of it, and as my recovery and my recovery focus got stronger, my recovery group got stronger, it became a nuisance. So it went from a necessity to a nuisance. And when it becomes a nuisance, then the realization's there is, hey, I'm done.
You've gotten somewhere.
I'm,
Yeah.
I'm okay. I've
Yeah.
gotten
Uh-huh.
somewhere. I am sick and tired of going wherever and having to pee in a cup.
Yeah.
And so it's a good program. Now, a lot of states don't have that.
Do you have a sense of like what percentage of states in
I,
the
I
United States?
don't. I
Okay.
don't.
Yeah, because
I do know
but we'll
people that
say
are,
California,
yeah,
no, we do not have this.
no,
Yeah.
no, it's not in California. And some boards in some states are much more vindictive than Minnesota. The one thing I'll say is when I went before the board, the head of the board looked at me and he said, I want you to, when you leave here, I want you to remember this. We want you to practice medicine again,
Wow.
but we want you to do it safely. That's what sustained me.
Yeah.
Now, a lot of boards are like, you're done, you're out of here, see ya.
Yeah.
So
And you're just, yeah.
so my heart goes out to fellow healthcare professionals who are struggling right now. We estimated there's, I think, 350 people at this conference. So statistically, if you look at, say, 10%,
Mm-hmm.
and there are those that think it's higher, statistically, 10% of these, so 35 people in that room probably meet the criteria for substance use disorder. We're not talking mental illness,
Yeah. Substance use.
which is another thing we do in our support group, and are afraid to get help.
How many people come to the recovery meeting?
This it's really small. It's intimate. I think there were 8 of us this morning.
Yeah.
But the
Okay.
nice part about the intimacy of it is we all had a chance to really share
Get to know each
and
other
and
and
and shed tears.
yeah.
Yeah.
Yeah. So what do you think that some of the answers are? I mean, from what I'm hearing, changing the discourse,
Hmm.
changing that perspective, providing a path back,
Right.
a clear path back so that those that are struggling have a way to access help and get back to their beloved profession
Right.
is important. Going back to that human first.
Right. Right.
And how do you change an entire culture view on humanity versus white coat? Like your TNT is doing it
Oh,
because they have
AT&T
you,
is
they
doing
have
a great
yeah.
job and really trying to emphasize the humanness, not only how we treat our patients, but to realize that there are 350 people at this conference that are all human beings.
Mhm. Mhm.
We may be here to learn about all these awesome topics in addiction medicine, but we're all coming from some pretty interesting places and some of them pretty damaged. And so bringing that in and expanding that, I think that as I look at this small group, we're not a counseling group. We're just to say we are here.
Yeah.
We're not alone because in the medical profession, addiction recovery are very lonely places to be.
Hmm.
They really are.
Mhm.
And I experienced that loneliness, but fortunately developed a recovery community. And over time, it also included physicians and nurses that were also on the journey. So we were able to help each other that way.
Yeah, and that ultimately is what gave you the resource to get through
Hmm.
your rock bottom
Hmm.
was that community, like, "I'll hold you up
Right,
when you're falling
right,
apart."
right,
That's what
right.
we need.
We do. All of
Yeah.
us need that. And again, going back to the small group is it's you see the defeated look in some eyes, and it's like, whether I give you a literal or figurative hug, I just want to let you know that I care. I
Mm.
care that you're here. And thanks for having the courage, because it takes courage to walk into a mutual support group.
Yeah.
Thanks for having the courage to be here.
Yeah.
And hopefully your burden's just a little bit lighter when you leave our meeting. And then you get to go out and guess what? Be a better provider
Mhm.
of healthcare services.
Yeah, and that's
So,
what they want.
yeah.
What would you want patients to know? Some people watching this may not be in the medical community, they may be like, "Wow, I never thought about this."
Number one, we're human beings.
Yeah.
And I know that patients will accept us maybe even more as human beings first,
Mm.
and then providers second. Um, and secondly, is that I hope that they see the culture changing more and more,
Mm.
that we as healthcare professionals are looking on them as people
Mhm.
first and then patients.
Yeah.
They have their journeys they're on. They have their struggles. They walk with a lot of courage into an exam room. They want to know that they're seeing me, a human being who also has a lot of flaws, by the way. And yeah, I'm a doctor too, but it's not who I am. It's what I do, which is a huge change from 20 years ago.
Awesome.
So,
I love that. Just getting back to core humanity on all
and
sides.
you know what? It really is. It's been a tough journey, but really looking at the whole picture, it's just a matter of being me
And saying, I love you in the mirror.
and being perfectly imperfect and saying, I'm fine with that.
Yeah,
You know?
beautiful.
Yeah.
Well, thank you so much for sharing your story. We really
Oh, you're sure
appreciate it. I
welcome.
think it's going to benefit many people watching it, whether it's medical students, professionals, patients.
Mhm.
It's just so important that we
Thank
see the
you.
humanity in one
Appreciate it.
another.
So good to be here.
If anybody wants to reach out to you to connect with you in any way, how might they do that?
drluthermd@gmail.com. Now I will do this is all small letters. drluthermd@gmail.com.
Love it.
And then I'm also on LinkedIn, Luther Philaya MD. I think that's they could if they Google
Okay.
that or whatever they can find it. So
Fantastic.
yeah,
Appreciate it.
you're welcome.